minister has said that we are ready. Readiness is a relative term. We can never, when you work with infectious diseases, with viruses, you can never be 100% certain. Some of the biggest countries in the world, the US, have had 8 importations, despite all their public health measures. The critical thing is that the country hasn't come to a standstill. They have found those cases, made the diagnosis, taken them to a treatment center for treatment, and have prevented further spread. So I think what the minister has meant by that statement is that we are putting everything in place that we can. He has given us marching orders. All the agencies responsible are working together. Every day we do a risk assessment at the NCDC. We have an emergency operations center set up for this. We're monitoring the situation literally every hour. The first question is about our land borders. Our current risk assessment for this particular virus is that most people coming back from China will most likely be coming through the airports. They are unlikely to be coming through the land borders to Nigeria Republic. But having said that, you're absolutely right. We do have the challenge with our land borders. There is government presence in some of them. In Europe, you go there, you see port health services today. But our land borders are a challenge, and I think the relevant government agencies and ministries and parastatals are doing their work. There's an incubation period. What it means is that between the time you get infected and you have symptoms, it's a period where you're well like anyone else, right? And you're right that when you cross the airport at that time, the thermal scanners will not pick you up because you don't have a fever. So our strategy, if you look at all the advisories that we've been offering, is to tell if you have come back from China in the last 14 days, if it is possible for you to self-isolate, to stay at home for 14 days, and then please do so. If for some reason you develop symptoms during those 14 days, our advice to everyone is to call NCDC on our toll-free number. It's on our website, and we've shared it through all sorts of media outlets, so that we will send a team to get a sample from you, so that you don't go into a hospital, because we don't want you going into a hospital and infecting others. We now have the ability to test for Lassa. And the quicker you get into a hospital, the more likely you are to survive. Secondly, we have increased the number of Lassa fever testing labs from 2-3 years ago to 5. So at the moment, we have 5 molecular labs, and these are complex labs that are able to test for Lassa. And we have started using a sample transportation system to get the samples from wherever it is in Nigeria to the lab within 24 hours. And thirdly, is that the expertise of the clinicians managing these patients has improved so much over the last few years.